While Minnesota's Medicaid scandal has received the most attention, there may be bigger fish to fry. Joining me now is the administrator for the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. Thank you for coming in, Doctor. Just to close up the Minnesota part of this story, is the state government now helping you to try to straighten matters out or not?
At least the state's starting to respond with a confidence that they can begin to take the action required. I want to thank Tom Emmer, by the way, who's obviously with you on the panel, because it's his leadership and others in the state who've brought attention both to the problem that Nick Shirley identified in his early videos, but also to the reality that if you don't take action, it's not going away by himself. You know, as a physician, I'll speak to the fact that if you ignore the truth, it'll sneak up on you and hurt you in all kinds of ways. And the best way to deal with an infection is to lance the abscess, let the pus drain out, the body will heal itself. That's what I'm hoping is going to happen in Minnesota. But you raised an important point, David, which is what's really going on around the country. And let me give you a high-level number. We think there's about $100 billion in definable fraud, waste, and abuse. To put that in context, if we just were taking out fraud, waste, and abuse in Medicare, we will double the life expectancy of the Medicare Trust Fund. So all those folks who are worried that Medicare is not going to be there for them after they finish working their whole careers, you have a lot more confidence in this beautiful social safety net, the crown jewel of our program, being viable if we get rid of the fraud, waste, and abuse. So when we talk about these other states that are in trouble, please remember that goal and general affordability of health care is of primary importance to the president.
Now, moving on to other states, I saw a recent ex-post of you in front of a adult daycare center in Queens, New York. I take personal interest in that because I was born in Queens, but I didn't know there were adult daycare centers being funded by, is it Medicare or Medicaid?
Well, those are funded by the state. They're Medicaid. But, of course, the federal government has to chip in more than half the money. So all the federal taxpayers should be interested in what's going on in New York. It's the tip of the iceberg. So think about it this way. There was an idea, a naive one perhaps, but an idea that's plausible, that you would help seniors if you gave them a place to congregate if they had only the alternative of going to a nursing home. But what's ended up happening in Queens, and these are insular communities, in the case of Flushing, Queens, it's a Chinese community, they have created a recruitment center at these social adult daycare facilities where they take folks who come in the door and they say, listen, here's the deal. Don't tell anybody, but we're going to give you $1,000 a month if you pretend like you're coming here every day, and then let us send a home health care worker to your home. We'll charge for that. They're not going to come, but it's you're going to claim they came, and then we're going to order you expensive brand name prescriptions that you don't need, but we're going to be able to get paid for that, and we're going to send you the rehab you don't need, and acupuncture that's not right for you. All that's going to generate revenue. And as a result of these kinds of scams, we busted one of these social adult daycare centers, the size of the studio you're in or smaller, for $68 million of fraud. On that same city block in Flushing, there were two other centers like that, and a police precinct, by the way, as well as the insurance company that was supposed to be auditing those centers. So you understand this is an insular, coordinated process, and I'm going to just blow your mind on this. In New York State right now, the number one job is not retail, is not working in fast food. The number one job in New York State is being a personal care service provider. Basically carrying your mother's groceries up the stairs, or driving a relative to a clinic appointment. These kinds of tasks that your family used to do for you for free, we're now paying people to do. Wow. And of course, there are no guardrails around that. So when I went down to the Southern District and met with Department of Justice, the Office of Inspector General, the FBI, they're pleading with us. They say, we can't do our job if you don't create defensible guardrails around these programs that are so porous right now, there's no way to law enforcement to clean it up. This is billions of dollars of fraud just in Queens and Brooklyn.
And there's nothing worse than people who take advantage of the elderly. I think everybody's had something like that happen in their families. It's a horrible situation. I want to move on to another fraud that's taken place in hospices around the country. I want to know how that kind of fraud works, but also an incredible stat that you came out with. 1/3 of all the hospice centers in the U.S. are in just one city, Los Angeles. Is that right?
It's absolutely correct. And you have to ask yourself exactly how many people are actually dying in Los Angeles. It's not 1/3 of all people in the country. Look at that. Almost 2,000 hospices in LA County, we believe half of them could be fraudulent. And the reason for this is because Los Angeles and the state of California, who regulates these hospices, was tolerant. They were perfectly fine with these systems sprouting up. We believe that many of them are created by the Russian mafia. In fact, when you try to bust these folks, sometimes foreign nationals run back to their own country. We're seeing this in other areas. And in Flushing, I just mentioned, we think the Chinese government might be involved. And in southern Florida, where you have twice as many durable medical equipment suppliers as McDonald's, we think the Cuban government's involved. And here in Los Angeles, we're seeing numbers that just catastrophically high. And it destroys the fundamental social network that exists to support Medicaid, and in this case, hospice, it's Medicare patients, where everyone's involved in fraud. The person building the big mansion with their ill-gotten gains, and literally, and I know this from a whistleblower, all the contractors have side hustles owning hospices because they know they can get away with it, and they make millions of dollars lying that people who are healthy on Medicare are actually going to die in 6 months, therefore eligible for this special program. But because of this dishonesty, it corrupts the entire system.
Incredible.
Thank goodness Billy Hussein, who is the U.S. attorney in Los Angeles, is taking this seriously. The president and the vice president who runs the task force are all over this program, and we're going to make massive dents in the fraudulent amount of hospice fraud. But again, these are examples. They're not the whole problem.
Yes.
They're just symptoms of a much larger malaise around our nation's past management of Medicaid and Medicare fraud. Much of it led, I'm going to be a little bit partisan here, by an almost overt disregard for rules in the Biden administration, where they ripped out the guts of program integrity, leaving systems that were so weak they could not guard us against these intrusions.
Doctor, I just want to, we only have about 15 seconds, but I want to get a quote in from Pennsylvania Senator John Fetterman, because he's a Democrat. It's not just Republicans that are supporting your work. Here's what he said recently. Roll tape.
There was a lot of fraud in Medicaid, and let's root that out. Who doesn't want to waste American taxpayer money on fraud for that? So it seems like that what he's zeroing in on, and as long as he continues, yes, absolutely.
He's talking about you, Doctor. Are there other Democrats who are standing behind the work you're doing? Quickly.
In private, yes. In public, they can't afford to yet because they don't want to make it seem like it's okay. My problem is I don't want to normalize fraud. And we are going after blue states and red states.
Good.
I wrote a letter to the governor of Florida about the fraud they have. He's engaging. We told him we're going to shut down some programs in Florida. He responded by wanting to shut down additional ones. Maine, purple state, same kind of interaction. And we've got blue states, New York, California, and Minnesota. They're not quite as responsive as Florida has been. This should be a national priority.
Doctor, wonderful to see you. Thank you for the work you're doing. Thank you for saving taxpayers money. Great to see you.
Thank you, David. Good luck to you.
Thanks very much.